Hello, this is part 2 of my quality management presentation, Policy 510, Public Management, Spring 2014. Contents of the presentation, visual and audio are property of and were created by Kristen Leo. After looking at so many of the things that Paul Levy did well, there is one area where there's room for improvement for Mr. Levy. His ultimate demise began in August of 2010 and eventually resulted in his resignation in January of 2011. In an interview with WBUR, All Things Considered, Paul Levy was interviewed as part of his book tour for Goal Play, Leadership Lessons from the Soccer Field. He spoke of how there were CEO diseases and he was victim of that. That even the best of managers at times rationalize poor judgment. And where he said that he agreed that he had made mistakes and that the best thing that he could do is that is to learn from it. We have to know that you need to be able to move beyond any missteps that you may make and learn from them. And the one thing that I took from this is that while his fall from grace didn't discount the work, I was glad to know that with this statement in the interview, he had learned from it. He says, I think the sign of a good leader, or for that matter, any person who wants to improve, is you acknowledge your mistakes and you see if there are lessons to be drawn from them and perhaps teach other people from that experience and go on. We know that he still has things to offer other troubled organizations, and the work that he did was very important for Beth Israel Deaconess Medical Center. What Paul Levy did very well during those first 6 months of his tenure was he provided strong leadership and strong management. He did it from the very beginning with his negotiation for taking the job. He started off the ground running with planning and controlling the recovery process for the hospital. He kept the focus on high quality patient care, and we see this because he didn't let go of any nurses, as was initially suggested in the Hunter Group's report. He could have, but he didn't, because he knew that they were directly impacting that high quality patient care, and without patients, the hospital really would cease to exist. And through his hard work in quality management, he ensured the financial, clinical, and academic successes of Beth Israel Deaconess Medical Center. One of the things that I thought was really important is that he knew that that link to Harvard Medical Center kept those medical doctors and those research people with those strong ties to Harvard University, and we know what that does for moving healthcare to a different place. So at the end of it all, how can we as managers employ good management practices? And we know that in the public sector, there's many aspects of the work that don't translate over into the private sector, but this really is, quality management is one area that, regardless of the organization, it's important. Typically, when things go wrong, the one characterization of the issue is that there was a communication breakdown. Communication is the most important aspect of moving forward with good management. Recognize people's work and successes. Involve your staff in making those decisions. Listen to them. They're doing the work. They're going to be able to find efficiencies that you may not know exist because you are too far removed. Allow for professional development, because staff that is continuing to learn and working on themselves really bring that into the work that they do on a daily basis. And for those people listening who may not be in a management position, how do you employ these aspects into your work on a regular basis? I think it's important that we focus on planning, controlling, assuring, and improving. Within each one's work, whether it's management level or somebody at a call center, there's room for improvement and communication and looking for improvement and resolving those issues that may be there that people may not be aware of. So even the non-manager can look to and improve themselves by listening to Paul Levy's work with Beth Israel. I conclude with the fact that Paul Levy led Beth Israel Deaconess Medical Center for almost 10 years, but we looked at just his first 6 months, and the example of his management during those first 6 months were incredibly impressive, and we should be able to take one element of his work and bring it into what we are doing on a regular basis. After listening and viewing the presentation, what can you do differently tomorrow? Could you approach tasks differently and find some efficiencies? Thank you.